Hello, good morning, good afternoon to everyone. Thank you for joining us today for another Facebook Live Lunch and Learn. Please give us a moment. We're getting ourselves set up on the back end here so that you guys will have all the links. We'll be able to see your guys' questions in the chat. And this is perfect timing. We're going to let some folks join us before we get started here. So give us one moment just to get settled. And then we are on our way to talking about some amazing programs that we have here at the center with two other staff members that we love to highlight their work, Alan Harmon and Morgan McDonald. So give us a second, we're gonna get set up here. All right. So we're going to throw some links in the chat here just to make it easy for folks to be able to get connected with us on our website and to be able to access our YouTube channel, which we have all of these videos archived as well if you prefer that platform. All right. All right, a little bit of a lag here, but folks should be able to see us now. Let's get ourselves. We hope everybody had a great Thanksgiving break or holiday break. If you don't participate in that holiday specifically, we know this month is particularly busy. We have a lot of holidays coming up and everybody's kind of closing out the year. So we want to just, keep in mind that everybody's time is valuable and we have quite a bit to cover today. Okay, all right, let's get started. Thank you guys all for your patience. All right, so again, good afternoon. Thank you for, and welcome to another Facebook Live. This one is particularly around a second part of our virtual community outreach session. We have different team members highlighted from our organization to talk about some of the programming and about themselves. And it's a great way for you guys to learn about what we do at the Center for African American Health. We like to thank you for your support throughout the years. You have given us some valuable things, your time, your testimony, and your treasure. These Q&A sessions are provided, help us provide an opportunity to share detailed information about the programs and resources. We feel it's important for you to understand the direct impact of your financial gift to our organization. One thing that we do ask you to do during this giving season is if you are able to, please give where you live on December 7th. That is Colorado Gives Day. We will have details available in the chat. Colorado Gives Day is an opportunity for folks in Colorado to support nonprofits such as the Center for African American Health. So as people are coming in, I'd like to introduce myself and tell you a little bit about the Center for African American Health. My name is Eric Moore. I'm the Director of Advocacy here. I've been working here for a little over 3 years now. For those of you who may be unfamiliar with our work, we have been in the community for more than 20 years with a focus and commitment to improving the health and well-being of the African American community. As we move through today's session, please feel free to type your questions in the comment area here on Facebook, and we will address them if time permits. So just brief introduction, we're going to be talking to two of our community resource navigators, Morgan McDonald and Alan Harmon. Harmon, I apologize, I'm sorry. It's Friday, please excuse me. All right, so we'll start with Morgan. Morgan, welcome. Please tell us a little bit about your background, what inspired you to join the center, and then of course, the programs that you facilitate.
Thanks, Eric. My name is Morgan McDonald, and I am the Community Resource Navigator at the Center. And I like to say I'm all things senior program, senior specialist. I'm all about the senior programming. And so I've actually lived in Denver, Colorado my whole life. This is my home, but my heart lives in Houston, which is my second home. And that is where I lived for a little over 5 years. And I attended Texas Southern University there, where I received my degree in health administration. And so while I was there, I was met with many experiences, had many opportunities, and it helped me kind of just uncover my passion and really just allow me to know that I really enjoy the nonprofit world and really love being able to create and make a difference. And so For that, I'm really grateful because it's really just kind of made me the woman I am today. And so being able to do the senior program and the senior wellness programs, it's allowed me to really be able to create and implement and make change. So. Oh, you're on mute, Eric.
I apologize. Thank you. I'm doing the most today. So thank you, Morgan. Great introduction. I do want to ask a little bit about the senior programming. We know that there's obviously things, there's a lot of programming where when we talk about our life and as a whole, a lot of areas that overlap. When we talk about nutrition, physical exercise, socializing, a lot of things can overlap. So wanted to ask a little bit more about these programs. How do they differ? How are they similar? And how does one person select the right program curriculum for themselves?
Right. So we have several different programs that we offer at the center, but with the senior programs, those programs include the Diabetes Empowerment Program, our Check Change Control Hypertension Program, our Aging Mastery Program, and our Journey to Wellness Program. And all of those programs are virtual and free to join. And so we have two amazing programs that we offer that provide support and education on diabetes prevention. And both of those are actually in partnership with Tri-County Health Department, and they play a really big role in as we kind of collaborate and facilitate those classes together. And those are the Journey to Wellness and the Diabetes Empowerment. And so with the Diabetes Empowerment Program, it is actually designed for adults living with type 2 diabetes. As well as a friend or a family member who's offering support. So that means a family member who, a friend or a family member who is helping their mom or dad or someone who does have type 2, they're able to kind of take this class and these sessions for them to get this information and help them. And so we do have that happen quite often. So that's really good to know that there's someone out there who's actually helping get this information spread. So in the 8 sessions, we discuss tools needed to better control your diabetes. So we utilize CDC's curriculum, and you'll receive information like tools on how to control your blood sugar, how to eat healthy, how to cook healthy, and other ways to reduce your symptoms. And so in this particular program, we actually offer incentives and group challenges to kind of push and encourage each other to really make a change and make a difference in the way that you are dealing with your diabetes. And so this would be for those people who have the type 2 diabetes, for the Diabetes Empowerment Program. So if that's a program that sounds interesting to anyone, please reach out to me. They all work a bit differently, but with the diabetes prevention, we have 2. So that is the first one, and then the Journey to Wellness. So the Journey to Wellness is a lifestyle change program, and that's designed for individuals who have never been diagnosed with diabetes. And so this is a program, excuse me, a full year program that is provided with tools to kind of become a healthier you and to discuss those really important topics like reducing risk for future health problems such as heart disease, such as diabetes. And so we cover a variety of topics within that full year. And so being together for the full year, it really allows us to cover more than one topic and to actually dive deep into the information that we are getting from CDC. This is a special program because it is a support group. It really kind of turns into a support group rather than an educational program, a regular educational program. And so we've been able to partner with the Denver Art Museum, rec centers, and other really important things that we need, resources that we need. And so this group really thrives on the challenges that are set, the education that we provide, and the education that we provide to each other. A lot of the times we're learning from each other in these groups. And so it's been it's been a beautiful thing to witness. I've seen total transformations within the year of being in the Journey to Wellness program. You see bonds be formed, and it's just a really nice program to be a part of. And these programs are once a week on Tuesday, and we meet for about an hour. And if that sounds like a program that interests, this is 18 and up. So anyone is welcome to join to go through that program with us for the full year. And so I have two other programs. I have the Aging Mastery Program, which is a program for adults who are 50 and up. It's also free to join, and it is a 10-week program, and it's designed for adults who want to build that playbook for aging well. So those people who are looking to kind of get that extra information, those tips on what they can do to age well, we cover a variety of topics. We're actually provided with curriculum from the National Council on Aging, and they provide us with this big core curriculum book where it's packed with information, resources, links, activities, and we cover those topics such as exercise, advanced planning, medication management, financial fitness, and even community engagement. And so a lot of the topics we cover, we are able to dive deep, and it is this program in particular is a program that a lot of the senior participants really enjoy. They really push each other, they encourage each other while learning and just really learning to create that lifestyle change. And so along with the along with the Aging Mastery, I have the hypertension program. And that program is an 8-week program as well, where we utilize blood pressure self-monitoring to empower participants to just take ownership of their health. And so the goal is to have each participant record their blood pressure at least twice during the times that we're meeting. And so we provide that blood pressure machine to them as an incentive, and as a requirement of being in the program is to take your blood pressure, and we're able to do the self-monitoring. We're able to talk about topics like healthy cooking, and we have a chef who comes in and really goes through what healthy cooking looks like as it relates to having high blood pressure, and what you can do to cook with, like what seasonings you can use, what food to eat. And we really are able to do a really amazing cooking demonstration in this program. And so that's one of the perks in this program that I like. But also we talk about medication management and advanced planning as well. And so this program also meets once a week and on Tuesdays at 9:30 to 10:30. So this is available for anyone who is interested. And if this is something that interests anyone, or you know anyone who has hypertension or high blood pressure, please reach out to me, because I'd be more than happy to give that information and kind of go further into what we do in this program. And so one thing I do want to say is in these programs, it really became clear to utilize experts in the community to help navigate the conversations as it relates to senior health, as it relates to health issues such as diabetes, such as hypertension. And creating that advisory committee just allowed for guest speakers to come in everywhere to partner and join these sessions to discuss certain topics. And so to name a few, that list kind of consists of pharmacists, nutritionists, doctors, chefs, nurses, life coaches, and many more. And so they are really awesome and a really strong foundation in some of the information that we provide to the participants when taking any of these programs. And so I am more than happy to talk with people further about these programs. These are ongoing. We like to do these, do cohorts. And so if you can't do it at that time, there's always going to be another one coming. So please feel free. My name is Morgan. My information is out there on the flyers. So please feel free to talk to me more about these programs.
Thank you, Morgan. And I will include also your contact information here on Facebook, so folks watching today can reach out to you. Great. I mean, it's a variety of programs. Thank you so much for going into detail about each one, who's it right for. It seems like there's a lot of good takeaways. Mainly it's just, that each program seems like it's designed to make sure that folks are walking away with knowledge that's relevant to them, skills that they can use right after that class, and as a lifelong skill as well. And that's the great thing about it too. It's something that people will expect, in a few weeks to be able to implement. They can leave that class and understand how to use it, because some of it is part of the curriculum. So that's I guess I would ask, as far as the programs, we know people are worried about in-person versus virtual. Which programs are virtual? Which ones are in person?
Right. So all of our programs right now for the senior programming is going to remain virtual. With the pandemic, we have just made that shift on being virtual for now. I think it has been working for us. I know some of the senior participants we're a lot more comfortable at home. And so right now we are virtual and we will remain virtual for the time being. And so if anyone is interested, you would just need access to Zoom to be able to participate.
Perfect. Okay, thank you. And I'll keep keep time in mind for everybody here. We're going to jump to our next facilitator. We'll answer all of the questions that are coming into the chat, and as well, I have a few announcements to give to everybody before we end the session today. So thank you, Morgan. We appreciate it. All your information. We'll make sure folks can get connected to you afterwards. So Alan, thank you for joining us. I'll start with the same line of questions that I gave to Morgan. Tell us a little bit about your background, what inspired you to join the center's team, and then some of the programs that you facilitate.
Good afternoon, Eric, and thanks, Morgan. I'm Alan Harmon, Community Resource Navigator as well. I facilitate all the parenting education programs. Originally from a little small town called Darby Township, Pennsylvania, which is like 5 minutes from the Philadelphia airport. Moved to Colorado after getting out of the Air Force a while back. And I got involved in this because I just wanted to give back to the community. Part of my background was I was a little league football coach before, and I just really enjoyed helping those little boys become great teenagers onto becoming, even better men as they got older. So, and I just wanted to give back and had the opportunity to get involved in the Center for African American Health. I volunteered with them for several years. An opportunity came about for me to do these parenting education programs.
That's great. Thank you, Alan. In particular, I know that, you spoke on male engagement, and that's something in particular. We have some new programs coming out. So I want to learn more about 24/7 Dad. That's a program that we have available now. So we know that that's new to us. So a lot of people aren't familiar with the curriculum. Can you explain a little bit about this parent education program that's geared towards Black fathers?
Sure. So the 24/7 Dad is a evidence-based program. It's a 12-week program, and we meet on Wednesdays from 5:30 to 7:30. And it's just an opportunity for men to come together and have conversations and dialogues about how to strengthen their relationship with their kids and their families, how to be involved and be better fathers overall, and also how to deal with some of their own emotional issues and, recognizing their feelings and having conversations with other men and hearing from other men of how they've been able to deal with some challenging issues in their life when it comes to their kids, but also when it comes to them as individuals. So it's a program that I'm really passionate about that started in September. I'll be finishing up a course here in a couple of weeks, a session in a couple of weeks, and we'll be starting a new one in January, on January the 12th. And it's just an opportunity for men to come, learn some more fathering skills, enhance the work that they're already doing, and just to be involved 24/7 in their kids' lives. And it's important for kids to have that father figure in their life. So whether you're a dad, uncle, guardian, caregiver, any man who's like just involved in a child's life should just come out, have a good time, have some conversations, learn a few things, and just enjoy being a great parent. The program, again, I said, is 12 weeks. There's incentives offered at the end of the program. We meet once a week. Meals are provided in our program. So come and grab something to eat, have conversations, and just talk about what's working and what's not working and how to move forward from, situations and where you're at when it comes to being a parent. And yeah, the 24/7 Dad program is open to any, doesn't matter the age, it's open to any man that's a father figure. So it could be an uncle, cousin, nephew, brother, expecting fathers, grandparents, any man that's just being there and being involved with working with kids.
That's great. Thank you. In talking about that, those important conversations with men around fatherhood, what it means to be a man. I know something that we want to preview a little bit. We have a Facebook Live that we'll have dedicated to this new program. he tells us a little bit about the Barbershop Talks, which we recently.
Oh, yeah.
Just
the Barbershop Talks. Yeah, I'm excited about the Barbershop Talks. So starting January 18th in 2022, and then every third Tuesday of the month throughout the year, we'll have these Barbershop Talks. So it's a safe space for men to just come and have a conversation about things that are affecting them, their mental health, relationship issues. We'll talk about some co-parenting stuff. We'll also talk about sports, community interests, how to strengthen just what the work they're doing and how to just be involved. And we want to have conversations like we do in the barbershop. So it's going to be relaxed, laid back, respectful, but also intentional conversations. An opportunity to just have that safe space for men to just have conversation with each other. The Barbershop Talks is a partnership with Families Forward Resource Center, and I'll be partnering those Barbershop Talks with Demetrius Jenkins. And check back for us on more about the Barbershop Talks. We'll be doing a Facebook Live about it on January 7th at the same time. And the two of us, Demetrius and I, will get together and really get into detail about what we want to do as far as like having these conversations, outlining it, and just welcome, brothers to come have conversations and just talk about things that affect us on a daily basis. So.
Great, yeah. And great timing too. It's a program starting at the beginning of the year. And as folks are closing out this year, thinking about how they want to be better with themselves, with the relationships they have in their lives, with pursuing their own goals, I think it's a great time for a program like that to show up that allows you to have that male bonding and be able to work on the things that you want to work on and be authentic about it. So I'm very excited for that. I was very happy to hear about that on our side of the screen. It was great to hear about this being started up. So looking forward to that in action in January. So Alan, stepping away from just male engagement, you do parenting education classes. I want to talk a little bit about strengthening families. So can you give us some examples about how Strengthening Families, that program supports and educates the participants that join them?
Sure, absolutely. So the Strengthening Families program is also an evidence-based program that's 8 weeks in length. And we get together and just talk about how parenting can be difficult and just enhance some of the things that parents are already doing. How to look at maybe different ways to deal with challenging behavior, how to look at different ways as far as discipline. But when it comes to strengthening families, the most important thing is starting early. So with our Strengthening Families programs, it's open to families with kids ages birth to 5. I've had expecting parents in the class, which is great because they get a perspective on what to expect going forward once their child arrives. The program is really helpful in getting people to understand that how we talk to and how we deal with our kids is important. Paying attention and listening to our kids and what they're thinking about and how they do, and not treating our kids as adults is very important. So with the Strengthening Families program, so far it's been really great and really exciting. Parents have learned that, they are doing the work that they should be doing and just taking away bits and pieces of some things differently. They've noticed changes in their kids' attitude, how they get along and how they relate, and how much more fun they are able to have once they're able to meet some issues head on, but meet them maybe in a different way than they have been doing. We talk about, again, challenging behavior, discipline, how to get your kids to, go to bed at a reasonable time, how to keep them on schedule, what's important to you as far as values in your family culture and things of that nature. So it's been a really rewarding program. And I really, really enjoy the work.
That's great. The programs, I love that one because it includes the whole household. And, it's amazing. We've had talks about caregivers. We've had talks around dealing with mental health services and thinking about how do we communicate that within the household better and involving children in that process, because it's something that we might feel the inclination to kind of shield them from, but we have to understand that they will be the future adults, the future business leaders, the future politicians, the workers of the society. So we have to make sure that we're including them in the right way and what is life and how to best manage it. So a lot of stressors that we have to deal with as a community. One thing I did want to ask about, and we'll say this before we do a fun group question, is around stressors. So, Alan, in your opinion, how prevalent do you think the stigma around mental health is in our community? Is it something that you see as still a struggle when it comes to seeking help, especially during this time?
I think from that perspective, it's still prevalent. I feel like our community still struggles with the fact that we do suffer from mental health issues, and that it's frowned upon to have a mental issue or to admit that you're struggling with something. My feelings about it is, and what I've heard from parents is that, being in a space and being able to express and hear that other people are still struggling just as you are, and being able to talk about it and have people to talk to about your issues that you may be struggling with is valuable and is key. Too often we look at in our community, we look at someone who may be struggling with mental health as weak, or as less than, or as that they're crazy, or there's something wrong with them, and they're really not. It's just about an opportunity for them to seek help, and it's okay to ask for help. It's more, you're showing more strength by asking for help than not.
Yeah, and I think that's the important part, is just really changing our mindset around, what is help? You know what I mean? Like, sometimes we look at it in a negative way, as though we're less than, weaker, we're not made or built for certain, lifestyle. And something that unfortunately it's I would say, personally, from my opinion, it's a way we can play deception on ourselves, that some things are not worth addressing, when that is such a big part of our identity and obviously our lifestyle. We make a lot of behaviors based off of how we're feeling mentally, how we're feeling as far as that. So I think it's something that's very important. I know COVID has made that a very big topic lately, because of everything that's just been associated with it. On top of the usual stresses that life brings, it's just something that's been very, very important for us to highlight and be honest about. So I'm glad we have programs that, all of our programs, I think, really reflect that aspect of inner self. So I'm glad that we have that as a component, and it's not something that we see as an afterthought. It's right. What we do and how we show up in life.
Yeah. I just wanted to say two more things about my programs. Both of my programs at the moment are in person, but starting in January, there will be a virtual Strengthening Families program. Starting on Monday, January 10th, there will be a virtual class, and then an in-person class will be on Fridays. With the 24/7 Dad, currently that's in person, and I'm working on a schedule to do a virtual version of that as well. So you'll have two opportunities to either do a virtual program or come in person and meet with other participants that are in the community, grow relationships, grow bonds with other folks, and just increase the work that you're already doing as families for both programs.
Okay, that's great. Thank you. I do want to make sure that we're keeping track on time. It's 12:28. I do have some announcements to go over. I know that we'll go a little bit over at 12:30, so I appreciate your guys' time. I did want to bring one question out from Facebook. It looks like this is more for Morgan. The question is that, and I think this is something that you might have mentioned. You had like 4 programs you highlighted. So correct me if I'm not wrong. Did you mention that weight management is discussed in the Journey to Wellness class?
Yes, we do discuss it in the Journey to Wellness class, and also in the Diabetes Empowerment program as well.
In the empowerment as well, yes. Okay, but perfect. Thank you, Morgan. So I guess before I go into announcements, and this will be really me just doing a lot of plugs before we close out, just wanted to pose a question that we can share here on the screen between the three of us. Given that this year is coming to a close, it's normal to think of all the people, events, and moments that left an impact in our lives. They're on us personally, on those in our community, or people around the world. My question is, what are the reflections you have made in this past year as we head into the next year? Are there any improvements that you see that you want to make going into next year? And anyone can actually start, and I can go if you guys don't want to jump into that first.
I don't mind starting. The one thing that I will say is that, yes, the pandemic has changed a lot of how we live and how we operate in the world today. But despite that, we're very resilient. We're even though we struggle at times with our mental health and being able to get out and physically do the things that we want to do, we're very resilient. And I think this pandemic shows us that if we lean on each other and we reach out to each other, that we're able to help each other, lift each other up, and move each other forward. So that's one thing that I've seen this year, just people coming together and helping one another and pushing each other so that they're elevated and that they're moving forward.
I really agree with you, Alan, on that. I think the special thing about the senior programs and just all of the programs that we provide, and they being virtual and being on Zoom, it's really finding that motivation for change. And I think that is what has this year has really shown me, is that there are people out there who are really trying to find that motivation for change and wanting these resources. And I think after the pandemic, it has really made people, and I just know for myself, made you realize what's important, and that's your health, that's your life, you want to make things as easy as you can, just knowing that, what we just have went through. And so I agree, we are resilient, and I just hope that we can continue finding motivation for change.
Those are great points. For myself, it's really a reflection I started last year once we, all the how do I say it, the shutdown, I guess the vaccine shutdowns occurred and everybody was quarantined. You had to work from home. You had to not be able to do your normal social gatherings and interaction. So for me, the reflection really has been about how I've utilized my own personal, social, professional networks and understanding that they've always served the purpose, but I sometimes didn't appreciate them. And it was because they were always available until they weren't. And once I realized that there was ways that I was showing up that could have been better for others and for myself, also that made me think more about what I want to do going into next year. And there's things that I'm implementing now, but that's a big one. It's about just really how am I communicating with other people and sharing myself and creating a space for others to do that as well. The people around you, you'd be surprised at how much of an impact they make in your daily life. And when things shifted, I think a lot of us can say that it was a big notice about how much of our routine, our lives changed when that happened. So I'm more grateful for the people in my lives, and I want to be better at being more involved in that going next year. So that's been my reflection, is just really how I've been being with other people. It's easy just to kind of be in a position of thinking about yourself, especially in a time of crisis, and just how you're going to come out. So that's something that I appreciate, and there's a lot of things that I want to make changes around next year. So I appreciate you all for sharing that. It's always nice to know a little bit more intimately about ourselves and to share that with our community. So very glad you guys did that. Thank you again. So I'll say this, we're at 12:33. I'm going to rush through some announcements. We appreciate everybody staying in, and we know that it's past our usual stop time. So I'll just kind of go through some announcements here before we close out for today. Anybody who is looking to get their first or second Pfizer or Moderna vaccine or booster shot or flu shot, we are hosting vaccine clinics. We have been, and we continue to. Our very next one will be here at our office. We are at 3350 Hudson Street, Denver, Colorado, 80207. That's in the Park Hill neighborhood. That's going to be this coming up Tuesday. That's December 7th from 2 to 5:30 p.m. The vaccines are free. We don't ask for ID, immigration status. We have no requirements around insurance. If you are getting a second shot or a booster shot, please just remember to bring your vaccine card. That way we can mark that once you get it done. Walk-ins are welcome. If you'd like to register ahead of time, you can call our main office at 303-355-3423. Something else I'll mention, we have a variety of other projects here. Oh, I apologize, I got a document kind of froze up on me here. So we mentioned in our last Facebook Live a few different programs around energy assistance. In particular, if you have any Excel energy bills that you might need help with paying, feel free to contact us. We will have contact information here in the chat on Facebook. We also do have a Facebook Live that we held that was with our another navigator of ours, John Young, and he's the one that you will talk to get that kind of program assistance. I also mentioned Colorado Gives Day. We do have a link in the description about that. Feel free, if you want to donate today or schedule a date before the 7th, please do so. We do appreciate your support. Let me get our other things up here. Gotta love technology. In addition to, I'll announce also, we have our annual health fair coming up, and that will be on February 12th, 2022. This will be our 20th anniversary of that event, so we want to celebrate with you all. We're letting everybody know now that is the date, so please save the date in your calendar. We'll have more information in the coming weeks about where it will be, times, different sessions, all the things that will be done during the event. But right now, it will be that Saturday, February 12th, be held from 8:30 to 3:30. So starting in the morning into the early afternoon, we'll be at the Renaissance Denver Central Park Hotel. If you're not familiar with that is, that's right off of Quebec Street and East 38th Avenue in Denver. If you are interested in becoming a sponsor for this event, please contact our development director, Angelique Smith, at angelique@caahealth.org. I'll have her chat and I'll have her information in the bio as well. So you guys will have all the emails and contact information. Do want to also mention that this Monday, December 6th, is the next run of our program for the Workforce Readiness program. We've actually had a Facebook Live as well on that specifically, and it was featuring the facilitator himself, Emanuel Wilder. So feel free, check out that video. He goes into detail about everything that program has to offer. If you're interested in enrolling, please contact Emanuel at caahealth.org. As far as behavioral mental health services, again, we're going to have some more information in the chat around that. But if you're experiencing an emergency related to that, please call 911. But if you have any non-911 related needs, please reach out to us. We do have resources around mental health wellness, and you can contact us using the same information that we use around the energy assistance. We have John Young. He's the one that will help you with that. So you can call the number 720-780-5619, or you can email contact@caahealth.org. Also, something that Alan mentioned earlier, we have that new Barbershop Talks program that's launching January 18th. That will be every month, third Tuesday of the month from 5:30 to 7:30. It will be at our building as well. We want to welcome all men and fathers to join us. I'll have Alan's contact information there. And finally, I'll just say this: the best way to stay connected to us when it comes to knowing about our programs, all the events, community news year-round, is to subscribe to our e-newsletter. And all you need to do is go to our website. We'll have a link there as well to help you guys guide you there. You give us your email, and then that way we can send you regular updates on things that are going on with the center and community. And also, don't forget, if you're on social media, like Facebook, for example, be sure to follow us. You can go to our website. We have easy click links to help you guide us directly to our social media pages. We are on Facebook, we're on YouTube, Twitter, and Instagram. And so we are out of time, very much so out of time. We appreciate you guys sticking with us, and thank you for our guests for being here. We want to wish everybody have a safe and fun a weekend ahead. Be safe during the holidays coming up. This video will be available along with other information on our YouTube channel. We hope everybody's doing well, and please take care.